Welcome to the Dr. Shawn Tierney Podcast. My name is Shawn Tierney, and I am a neuromusculoskeletal synologist. I treat athletes and high performers. My goal with this podcast is to help you make better decisions regarding your health, athleticism, and all aspects of life. Here, I'm both a student and a teacher. Thank you for tuning in. This is Dr. Shawn Tierney with the Dr. Shawn Tierney Podcast. Thanks for joining us. Today, our special guest is Dr. Adam Lustig. I'm super excited to have Adam here. He's a doc that does family practice, functional medicine, regenerative medicine, sports medicine. Very respected practitioner, and his office is in Santa Monica with BioReset Santa Monica. Adam, so glad to have you here. This is about you, so we're gonna learn about you as much as we can today, and how you came to be here. So why don't you start with how you decided you wanted to become a doctor? What started you on this path? Where you grew up? Those kinds of things.
Yeah, so I was lucky. I had a family member who was doing functional medicine. My aunt, who she had been doing functional medicine kind of before functional medicine was even really on the map. And when I was a kid, I was a young athlete. I would have injuries, shoulder injury, elbow injury, playing baseball. And then she would always just fix me up. And then anytime I had allergies or gut issues, she had a supplement for me. She had a plan for me. And so I was always kind of leaning in that direction with medicine. I would go to my pediatrician and always be like, my aunt's got a better thing for this or whatever. So I was fortunate to be exposed to that young. And then, so I kind of knew I wanted to be a doctor my mid-teenage years. And then I basically knew that, so I went into kind of undergraduate at Tulane in New Orleans, knowing that I was going to go straight into pre-med, do that whole thing, apply to medical school, and end up becoming family medicine ultimately. And I kept it open, but ultimately that's kind of what I chose because I wanted to kind of learn everything. And I knew I was going to do some level of functional medicine. And was super interested in musculoskeletal medicine. I went to an osteopathic medical school. I was a teaching assistant for osteopathic manipulative medicine, which you as a chiropractor are very familiar with. And I ended up really falling in love with musculoskeletal medicine, and ended up going to do a sports medicine fellowship to kind of further that musculoskeletal interest. And we could talk about the path along that way.
Oh, yeah. Well, there's a lot of interesting things that happened there. So let's just kind of go through. So you went to college. That was 4 years.
Right.
And then you went to medical school.
Yep.
And that was in Manhattan.
That was in Manhattan. Yep.
With Touro College
of Osteopathic Medicine.
And so you're in medical school and you're trying to figure out, hey, what do I want to do? Right. So all of a sudden you had, gradually you probably made some decisions. Hey, this is the direction that I want to go.
Right.
And I think I have some clues based on, your aunt's situation, but let's kind of walk through that process. I mean, obviously it was an expensive process.
Yeah.
But it was probably,
say that again.
It was probably emotionally and physically expensive as well.
Yes, for sure. So I actually only applied to osteopathic medical schools because I wanted hands-on manipulative therapy. I kind of was like, I kind of want to be a chiropractor, but I also want to have the medical background. So that's kind of how I ended up choosing DO, and I only applied to DO schools. And then kind of all this time throughout even my teenage years, undergraduate, I had been kind of reading functional medicine books, talking with my aunt, of course, listening to podcasts, listening to Mark Hyman's podcasts, other podcasts, and just kind of try to educate myself on alternative ways of healing. And so that was kind of a big passion of mine. I've been doing that all along. And so kind of all that in my head, I went into osteopathic medical school with an open mind, thinking about all of the different specialties. I did my surgery rotation. I was like, maybe I want to be a surgeon. Maybe I'll be an orthopedic surgeon. It's cool. You cut people open, you get that instant gratification. And so I loved that. But then ultimately I ended up deciding to do family medicine because I think that was the backbone of healing and preventative medicine and functional medicine. And so that's kind of how I ended up doing that. All in the while, continuing to think that I was going to do some kind of musculoskeletal medicine too, because I was really interested in OMM. And then, so I did my medical school at Touro College of Osteopathic Medicine. And then I did my family medicine residency at Columbia University in New York Presbyterian.
Pretty prestigious place to do your residency. So how did that, I mean, that's from an osteopath going to a medical residency. That couldn't have been an easy jump, right? I mean, especially at Columbia.
I mean, I was kind of determined to get the best medical training I could possibly find. And I kind of wanted to stay at home in New York at the time. And Columbia was, I had done an intern, they call it an elective rotation, your fourth year medical student. So they learn about me, I learned about them. And I kind of saw that their residents compared to other residents were just super smart, super with it, like can handle anything. And so I was like, I want to be them. And so then I kind of chose that. And it was definitely a grueling but super rewarding experience at Columbia for sure.
I just realized, hey, when you were at Columbia, there was a big change in the world. I mean, it was right. Like, so what happened? I mean, you went through something where you're the center of this pandemic.
Interesting. I mean, I started my residency 2019, summer of 2019. And so, we're starting residency, everything's perfect, not perfect, but learning a lot. And then halfway through, February, COVID hit in New York City. And, I'm a young doctor. I didn't really know much yet. I mean, we're starting to learn 6 months in, getting used to how the hospital works, getting used to how rounds work and all of that stuff, presenting. And then COVID hits and we're all kind of back to square one. We kind of don't know what this is, how dangerous this is. I mean, there's so many, it was kind of New York City shut down. I'd be on the subway, going to work at 5 a.m. I'd be the only one on it with like 2 masks. And there was a lot of unknowns. There was a lot of fear going on during that time. And as a young doctor, it was definitely kind of probably a N of one, relative to my classmates and other residents at the time who were in their first year. I mean, maybe compared to the flu in the early 1900s of a resident, it probably wasn't, we're pretty unique. It was a pretty unique situation.
Well, yeah. So you were in there and you were learning, but everybody was learning. I mean, you're supervising doctors, they didn't know what the story was any more than you did at that point.
I would say that's true. I mean, they had the experience of, ventilators and intubation and respiratory illness, but we kind of didn't know how the severity of it, what we needed to do, things that we did at the beginning weren't necessarily the things that we did 3 months later. People were just getting intubated left and right. There are things that we look back at that we probably would have done differently, but we were all kind of learning and I think my attendings did a great job of still leading the ship at a time where they probably were scared themselves, so.
Oh yeah. I mean, there had to be a lot of fear. I mean, because you didn't know what you were dealing with, but you were in the middle of it. I mean, every day you were dealing with somebody who had this new pandemic that the whole world was afraid of. And you were in New York City, which was pretty much the worst place in the United States to be at that time.
Yeah, I would say New York City just got slammed very quickly. I mean, the ICU that I was, I had done a month of rotation, and also the hospital floor, which I was on more. We'd have rapid response calls all the time, needing intubation. And so you go see, I remember this patient, I went to go see him. He's like, "Doc, something's not right. I just don't feel right." And then, I went to go get a vitals machine. His oxygen was 66. And, and it just happened in a flash. And so things that kind of were maybe taking a longer time, like a respiratory illness or a pneumonia, things would go south real quickly, real fast, and you'd have to make decisions really quickly. But yeah, it was definitely a crazy time. And unfortunately, a lot of people passed very quickly, and the ICUs were overrun. And it was my classmates. For us, we talk about it all the time. We're kind of have like kind of war buddies in that way of going through something like that. So I think it made us better doctors in the long run. I think we were kind of, everything after that became easy. Basic heart failure became easy. Diabetes became easy. Insulin, all that stuff was easy compared to facing COVID at that time, I would say.
You were watching, life and death.
Right.
From just straight out of your internship. And so it was very, very real. And you have to think, New York City was hit really hard, but how many and residents kind of run the show. I mean, it's just like exactly how much work does residents do compared to the rest of the physicians? What do you say?
In that situation, we actually did a lot. Part of the protocols at the time were actually to protect the attendings. And I don't disagree that this was a decision. I think it, makes sense. Attendings are usually older. They're making decisions. Some attendings would, my attendings did go in the rooms and stuff like that, but I heard about attendings who wouldn't really even go in the rooms, or they'd look through the window. And the residents would be the ones really seeing the patients and managing the patients. And so we were kind of the foot soldiers at the time. Fortunately, a lot of us were young and healthy. And if we got COVID, we'd probably be okay. But there was always a wonder in our minds, like, hey, we signed up for this. We're kind of in war right now. We're kind of, soldiers in war. We might get hit with a bullet. There might be a bomb. But this is what we chose our lives to do. So we were kind of all okay with it. And, we did that. And, things that stand out for me at that time were, family members at that time. If anybody remembers, family members couldn't visit their loved ones who were literally dying and didn't know when they were going to die. And, what I would do, and I did this probably over 10 times, maybe more, was basically FaceTime the brother, the son or daughter, sister or sibling to the dying person. And it would be the last time that they saw them. And so they'd be kind of maybe they're going to pass tomorrow, 2 days, 3 days. And I'd be holding up the phone and being like, here, talk. And I'd be listening to what this is. And it was like, I'm getting emotional talking about it because it was a crazy time. And, you couldn't see your dying loved one. So it was just wild stuff.
You were kind of the only person actually there with them through their.
Us and the nurses. The nurses were amazing during that time. They would go in the rooms even more, than anybody. So the nurses really were running the show and taking care of a lot of stuff during that time. But it was nurses and residents mostly. Yeah.
Well, that's definitely a traumatic thing to go through. I mean, it's traumatic for the country, traumatic for almost everybody. But I think when you're in the middle of it, and then how many residents? I mean, what's 5 million people in New York City?
Now I think it's 10 million, but in Manhattan, it's somewhere probably 1.5 million or something like that.
And how many residents were there in Manhattan for that 1.5 million? In
Manhattan, I think New York City in general, residents in the Bronx, Brooklyn, the boroughs also got hit really hard. I don't know. I mean, there were a lot of programs, a lot of internal medicine residents, a lot of medicine. I mean, probably 1,000 residents at the time, maybe less, maybe more. It's a guess, but we're all kind of bonded by that for sure.
Yeah. Well, so you went through this traumatic experience, and then you decided you wanted to focus on one side of medicine, at least for your fellowship. And that was sports
medicine. Yeah. I mean, all along I kind of knew that I needed the hospital training to become a medical doctor. And so I went into it with open arms, and I actually enjoyed it, and it was rewarding. But ultimately, I always knew that I kind of wanted to do, what they call outpatient medicine. But we do a different type of outpatient medicine, which we'll get into. But that was something that I kind of always knew in the back of my head, and decided to do a sports medicine fellowship. So you could do. As a family, once you go into family medicine, you can't really go and become a cardiologist. You have to do an internal medicine residency for that. But family medicine residency is 3 years. And then they have a couple of fellowships that you can do out of family medicine, sports medicine being one of the most popular ones. And so they call us primary care sports medicine doctors or physicians. And in sports medicine fellowship, you learn, how to diagnose musculoskeletal issues, really all non-surgical orthopedics is usually what I say, reading x-rays, MRIs, non-surgical management of orthopedic issues, and then also athletics. So managing athletes, managing the male athlete, the female athlete, and being on the sidelines of practices and traveling with, teams. For example, I did my fellowship at University of Miami, and I traveled with the football team, and so I was on the sidelines for the U. Shout out to the U, who are having a great year this year. And so that was it was just really, I loved that year actually. It was great.
Well, living in Miami is not ever a bad deal, right?
That was good. That was good fun. Yeah.
All right. So you got through your sports and you got through your residency, you got through your sports, you got through your medical school. And you're not getting paid very much in residency and fellowship. And so you come out of there and you've invested a lot in your education, unless you had be fortunate to have a family that covers everything, which almost not many of us are.
Most of us don't. I certainly didn't.
Yeah. So what would you say the average, physician coming out of school is owing, like, from your generation?
I mean, onwards of hundreds of thousands of dollars, anywhere probably from $300,000 to $500,000, depending. Some people are fortunate; they go to a state school or something like that, where it's a little cheaper, but it still could go $500,000 for sure.
Yeah, and that's a pretty big debt. So then you have so you go through all this schooling. I mean, a lot of other people, went through 4 years of school, or maybe a master's, or maybe even a PhD. So then there are 6 years in. But now you did 4 years of college. 4 years of medical school, 4 years of residency and fellowship.
Right.
So now you're 12 years in.
Right.
And then you really haven't been paying down that debt that much, right? So now you're coming and you're.
I didn't get into crypto.
Right. Yeah. So then you just get in, and all of a sudden you have this, you're in your late 20s, and you have $400,000 or $500,000 in debt, most likely.
Yeah.
Everybody else has been making money that whole time.
Right.
So you're like, oh, these guys are going to be wealthy. Well, you started later, so you need to make up for that. And then you get out, and you fortunately. And how did you find your next your landing spot here now, after all of you've been through with these?
So, I mean, I went into sports medicine fellowship thinking that I was going to incorporate some element of functional medicine, primary care, because that is my backbone. I'm family medicine. That was always one of my passions. So, but then it's like, how do you combine functional medicine and sports medicine, or non-surgical orthopedics, whatever you want to call it? And so I kind of didn't really fully knew, but I did do an elective in sports medicine during residency, and I saw primary care sports medicine doctor using ultrasound and doing ultrasound guided injections. And I was kind of blown away and fascinated immediately, because I was like, wow, this is like an amazing tool. We can see inside the body. We can put stuff where we want to put it. We can be super targeted. It's not that painful. Like, the opportunities here are endless. And so kind of went into sports medicine fellowship thinking that, I'm going to come out doing, learning ultrasound guided injections and understand athletes and learn more, sports medicine, primary care. So, I kind of didn't really know exactly how I was going to put it all together. So then we can get into the story of how I met the founder of BioReset, Dr. Matt Cook, who, I had heard on a Dr. Mark Hyman podcast, who was talking about kind of functional medicine philosophy, but also incorporating regenerative medicine philosophy using ultrasound guided techniques and treating the spine and doing all kind of really cool stuff. And so I heard that, and I was like, wow, this is it, because anybody who's combining functional medicine and regenerative medicine and doing it in a really awesome technical way is what I think is the future. And so I kind of thought about, him and what he was doing. And I know there are other doctors doing out there, but there's not that many. And, doing functional medicine is a whole career. Doing regenerative medicine injections or ultrasound guided injections in sports medicine is a whole separate career. So when you try to undertake both of those, it's kind of like, whoa, this is like two jobs that I'm trying to accomplish here. But yeah, so I ended up meeting Dr. Cook at an ultrasound course, MSK-US course. And I talked to him, chatted with him, told him about my passions. And I guess I demonstrated some level of, energy and passion that he saw. And he ended up offering me a position here at BioReset, which has been amazing. So.
Well, that's awesome. So here you are now. You kind of got one of your dream positions. I hope.
For sure.
And you've been through a lot, and you've learned a lot. You've been through some trauma, and now you're doing it. Now you're learning, but you're still learning more.
Yeah.
So
let's with your help.
Yeah. That's my honor to be able to help you out with that. And it's just it's a process. So we're always, you think that after 12 years of residency, and then I mean, 12 years of education.
12 years of education.
Including residency and fellowship and all those things.
Right. And then you can include high school too.
Yeah. Yeah. And high school before that and grade school before that. It's all of this, investment in yourself and financially. And now you're still on that path, which is outstanding, because a lot of people are like, I'm done.
Yeah.
But it seems to me you have this passion to achieve excellence, and really excellence for your patients.
Right.
So I like seeing that, and what I like about it is you do it in a very humble way. You're not coming through with this. I went to Columbia. I'm a Columbia resident. A lot of people probably do that. I mean, but that's not where you're coming from. So in this process now, you're doing regenerative medicine. You're doing functional medicine. Is there a case or two that stands out as you as like, oh, this is what I'm doing. I feel really good about it.
For sure. I mean, I think, when we think about the patients that we see, and you don't necessarily want to categorize patients, but patients will generally either be kind of pure sports medicine, low back pain or knee pain or shoulder pain, or weekend warriors, which we see a lot of, or they're going to be a lot more complex. They're going to have complex immune issues, plus, numbness and tingling in their hand, plus neck pain. And so I kind of think about those two types of people a little bit separately, because you have to approach those kind of separately. And so, I have definitely cases of, one, for example, a knee case comes to mind where, a patient who had ACL surgery 10 years ago had been dealing with knee pain in the area of the anchor where they put the ACL, which, the ACL gave him stability, but there were some kind of post-surgical things that were still causing him pain. And, this was a kind of partly a learning for me of, we want these regenerative medicine products to work right away. But when we're trying to remodel things, it can take a little bit longer. And we say sometimes 3 months at least before things are really changed on a physical level that we can see, and then manifests as symptomatic relief for the patient. And, this patient who had texted me like maybe a month and a half afterwards, he's like, I'm a little better, but I'm not fully better. I'm like, just wait, just hold off. Let's not jump to any conclusions. And then like 6 weeks later, he texts me, I'm 95% better. I'm back to golf. I'm back to kind of doing the things that I love. Hey, but also my back's hurting. We didn't talk about my back. My back's been hurting for 5 years. Let's take a look at your back. So that was kind of a rewarding one. And then, on the other side, when I think about the complex cases, we see a lot of patients with kind of what I call an autoimmune spectrum, or whatever, different doctors and different specialties will call it different things. Rheumatologists will call it rheumatoid arthritis or MS, and, alternative practitioners will call it something else. And we call it, autoimmune spectrum, complex immune dysregulation, and trying to get to the source of what's driving that. And, I think about one patient who, has been dealing with maybe a autoimmune neurological issue where we did some hydrodissections that, got her a lot better, and did a stellate ganglion block, which we might talk about, and got her a lot better. And then also thinking about the system and looking at her labs and kind of getting her on a protocol. And so she's gotten better. So kind of everywhere in between. And it's a journey for some of those patients, but we do end up getting them getting good results.
Yeah. A lot of these patients, I call them lost patients.
Yeah.
They're lost because they're lost to standardized medicine. Right. And you're coming in here with something that's going to very precisely diagnose these people and guide them to a path of health. And a lot of times people come through, it seems like their physicians almost look at them like they're crazy because they're not getting better. And I think it's so hard, because I see this all the time, to be a standard medicine and to have somebody who's not getting better, and you feel like you're just, you almost want to give up because you're not getting the results you want.
Yeah, and we see a lot of patients.
It's demoralizing for the doctor. It's demoralizing for the patient. So when we go through this, what you're doing with is a very advanced functional look at medicine, which I look at it as, there's maybe 20 or 30 standard tests that are done on a blood, and all of a sudden you have, I don't know, 100 or more, right?
Over, yeah.
So you're looking at, you're going to be at a better understanding of what something is if you have a bigger net, right? You're looking at, if you're looking at 30 things versus a couple hundred things, you're a little more likely to see what's happening in reality. It can be a little overwhelming too. So I think that's a little bit of, it's like, okay, I have more information. Do I have too much information? And how do I make a good decision? So I think that's
the art.
It's a lot.
Yeah.
I mean, it's a lot to take on.
Well, I think that a lot of these patients, they just don't fit the current standard model, right? I mean, they have a normal, all the blood work you get from your doctor, like a CBC, liver function, kidney function, vitamin D, all of it's fine, and then they mention that, they have some trauma or they have anxiety and they get kind of in this bucket of psychiatric. They get sent to a psychiatrist, they get on an SSRI, they get diagnosed with, anxiety, depression, and then they're kind of really living with an immune problem. They're really living with, kind of chronic things that are kind of under the surface that traditional doctors aren't looking at. And fortunately, I had been trying to do my due diligence and listen to podcasts and read functional medicine textbooks and all that stuff just to stay up to date, because it's not something that I learned in residency. We learned things about how to just manage disease, right? How do we keep this A1C from going from 8 to 9, right? How do we keep the blood pressure from going from 150 over 90 to 180 over 90, so we're kind of now trying to reverse things. We're trying to get to the source and the root cause. And I don't know why I have this, but I'm just somebody who will not stop until I figure out the why of everything. And it's kind of a blessing and a curse. I mean, I'm using it to my fullest advantage in this job, in this position. But, I think that you have to have that to really do the investigative work and the commitment that it takes to figuring this stuff out. And I think that we may get the help of AI technology in the future with this, which is going to be kind of amazing. And hopefully, I don't know when that's going to be, but for now, it's kind of an art of deciding what to treat first, how to treat it, not push too hard, not push too slow, and get people better and kind of synthesize a treatment plan.
Yeah, I see that a lot. I mean, there's two ways that I see physicians come out. One is that, you have so much information, you have so much investment, that the person doesn't get better, they must be wrong. And then the other side is, I have a lot of education, I have a lot of investment, but I didn't get it right. What else am I not seeing? What can I learn? And why? And that's kind of like that's your style. And I think that's kind of what we want to see. If you're a person who's in trouble, you want somebody who's always willing to say, maybe I don't know, but there's more I can learn. Why? And also in the process of even at this point, years of going through this, you have that capacity to kind of guide that why just right off the bat coming through the door. So that's a good perspective. I think that's what people are looking for.
Yeah. And I think I think a lot of doctors want to do that, but either they don't know where to look to get those tools, or they're in an insurance model where it doesn't support that view of really diving into like someone's diet and lifestyle and talking about their trauma. And
yeah, when you have to see 25 patients a day and you get paid on half of them, and they all want their prescription, their disability, and all this paperwork, then you're overwhelmed just with managing, just the paperwork needs to be done, and it's hard to to get to the patient to be actually better. And so it's demoralizing, I think. So yeah. I think it's good for the doctor as much as it is for the patient to be actually solving problems.
Right.
And then you have this other field you're working with that's, the regenerative side, which is like, okay, now you see something else, right? So tell us about that.
I mean, regenerative medicine is kind of I see it as the next phase of functional medicine, because it's really trying to move the needle in physiology and figure out, and it also is trying to figure out what's going on. And I think the backbone of regenerative medicine is really the immune system. And, we can talk a lot about that and, whatever stem cells and PRP and all of this stuff that is working through the immune system, and trying to regulate the immune system, give the immune system more resiliency. And that's really what functional medicine always was trying to do, and it always is trying to do. But these are maybe a little bit more interventional treatments, sometimes with a needle, sometimes with an IV, that are going to maybe move the needle more than, a supplement that you're going to take for 3 months or 4 months or 5 months. So I think they're synergistic, and the expertise in both is hard to come by, and that's what I'm striving to attain.
Yeah. Well, there's a lot to learn there. I mean, it's just not, so you have this, it's almost like you have this chemical side, you got your organs, you have your mechanical side, you have your muscles,
Right.
your tendons, your bones, your ligaments.
Right. The physical.
And then you have, you also have your neurological side, which all of a sudden is not just
Right.
motor and sensory. You have this autonomic side. Now that just kind of goes kind of the wrong way when your immune system is off. Because
thanks for bringing that up. Yeah, absolutely.
So that autoimmune side is one of the things that we've been working with. So
yeah, I mean, I think that's something that over the last year or two that I've really realized is the power of the nervous system. It's kind of funny because I majored in neuroscience as an undergrad. So I kind of have always had like an interest in neuroscience and why we do the things that we do, and biology and a little bit of philosophy and consciousness and all that stuff I was really interested in. But I think thinking about it from the clinical aspect of the nervous system, how the nervous system is really our body's intelligence and how our body communicates with itself, and really understanding that, and how, there's a book, obviously The Body Keeps Score, and our nervous system for sure keeps score. And you see that, I see that. And whether that's kind of coming from the brain, whether that's the connections from the brain to the rest of their body, we see those connections being compromised. And when those neurological connections in the nerves are compromised, whatever it's innervating the function is going to be affected, right? And sometimes it's not even that you're feeling pain or numbness or tingling, but you'll be like, my hand's not working as well as it used to be. And sometimes the differences are even subtle. But the nervous system, when we think about trauma, PTSD, the brain, and trying to reset that, trying to get that back to what we call, our birthright, or however people want to describe that. And that's where Dr. Cook came up with the company BioReset, which was resetting that nervous system so that it's back to your factory default settings, so to speak, and trying to regulate that. I think that's how we start to move the needle on a lot of these patients.
Yeah. And we've been, working with that for a while. And I think it comes back to, even with this, what we're dealing with now is, you dealt with in your residency, the initial impacts of COVID. And then now I think, we're all seeing this, maybe some other residual effects that affect maybe the younger people as much as the older people, where there's this dysregulation of the autonomic system and important nerves like the cranial nerves that have, these long COVID symptoms. And sometimes it's functional medicine, sometimes it's actually this nerve that directly in neuroanatomical problems.
Totally. I mean, I think long COVID is something that everybody's talking about now. I mean, you hear about it on the news, you hear about it, like a friend of a friend has long COVID, and a lot of people don't really know what that means. I think when we think about long COVID, it's twofold. We think about the overflow bucket theory, where kind of these chronic infections or chronic infections or other inflammatory stimuli, toxins, what have you, the gut, it kind of reaches a threshold where now the bucket's leaky, and it manifests as symptoms of fatigue. It manifests as kind of headaches or whatever kind of weird immune systems people have. And then COVID can add on to that and can make that bucket leaky, because if you have 2, 3, or 4 things, that's way more, that threshold's going to get broken, and it's way more difficult for your immune system to handle all of that. So COVID is one of those things, and we're seeing it actually be a chronic infection, kind of like a EBV, which is traditionally for years and years, especially in even the chiropractic community in the 70s and 80s, they were aware of, and its association with fibromyalgia. And so COVID is kind of becoming something like an EBV. And that's one side of it.
And that's Epstein-Barr virus, which is a chronic.
Epstein-Barr, yeah. Right, mono. So EBV is the virus that causes mono in teenagers, the kissing disease. But oftentimes you have the acute illness. But then once the acute illness and the swelling and the fatigue goes away, it actually lives inside your body. And it may not be an issue for most people who don't have all these other things going on, because your immune system is able to kind of keep it at bay. And so that's kind of how I think about it. It's kind of a war. And when your enemy is rising, and there's too many bad guys, your fort's going to get overrun. And that's kind of our immune system. So that's kind of COVID, how it can cause that overflow bucket. But then COVID also has been found to live in cranial nerves, right? So they actually have done, biopsies of cranial nerves, and they see that the COVID virus is actually living in the cranial nerve. And so people with, COVID, even when you have acute COVID or long COVID, are having things like vertigo, headaches, POTS, which is where you stand up and you feel super, dizzy and lightheaded. And so I think we think about it at both things. And so how do we address both the other chronic things that have been brewing and going on for a long time? And then how do we address the actual COVID illness?
Yeah. And we have that procedure where the cranial nerve procedure, the C1 plexus.
Yeah. And so this is a procedure where we're, injecting not into the cranial nerves themselves, but around those cranial nerves. And so sometimes those cranial nerves can be inflamed. And over time, those cranial nerves basically can become fibrotic and scarred if they've been inflamed for a while. And so they can actually be dysfunctional just from the physical kind of scar tissue that's around them. And then the other idea is to actually deliver some kind of anti-inflammatory product to that area to try to decrease inflammation in the cranial nerves. And so we've had all types of patients feel immediately better after this injection. It's not perfect for everyone, but, and it's a very technical injection to do, and important to do it with somebody who knows what they're doing. But it can be really, really effective for people. And I've seen people get a lot better just from that injection alone without doing any of the other stuff, which I think is still important. But if that's 30 or 50% gives you a 30, 50% benefit, then, that's amazing, right?
Oh yeah. And we've seen it be amazing for a lot of people. So it's gratifying to see those,
It's one of those things that can really move a needle.
Oh yeah. And the other aspect, and part of that is addressing actually your vagus nerve and your sympathetic chain, right? So that's a part of that plexus there too. There's the other big gun is using the Stellate block. So
which you've taught all over the world for years and years, and so the way I think about it, as I saw it, is it's a way to basically stun your nervous system for a second and try to get it to, if you imagine something kind of shaking and spazzing, you're able to kind of just calm it down, relax, turn it off for 4 hours, have your parasympathetic really, really go up, which is your kind of rest, regenerate, restore nervous system, which is where we all want to be. We're kind of laughing, we're enjoying, we're in the moment. That's parasympathetic. That's where we all want to be. Sympathetic nervous system exists as a way for us to kind of run away from the bear or, get away from danger, what have you. And so we really probably only need to be in sympathetic nervous system state 10, 20%. But a lot of us in this crazy world of ours are probably more like 40, 50, 60%. And we can't heal when we have our sympathetic nervous system in overdrive. And so when I think about a lot of these patients who are have complex immune issues and also have trauma, these are the people that probably can benefit from the stellate ganglion block early on in their treatment course, because you're resetting that anxiety, that fight or flight. And now you're more in a parasympathetic and your immune system can kind of work better. And because your immune system doesn't like the sympathetic nervous system, it's your cortisol is high, it's immunosuppressing. And so your immune system really wants to be in that parasympathetic state. And so I think about it from that perspective. And then also people, it was studied in veterans who just had PTSD from war, who immediately got better and was resistant to all other things, multiple drugs. And that's kind of really how it got started. And so people, these veterans got these stellates and they were basically healed from their PTSD immediately, which is fascinating. And so I think we're just almost scratching the surface of what this stellate ganglion block really can do for people.
Oh yeah. I mean, it's one of those things that everybody needs it at one point. I think at some point it's be like, okay, you get through college, stellate block. That was stressful. You get through medical school, stellate block, stress. Residency for sure. Internship, probably so. Fellowship, maybe, right? Divorce, for sure. Taking care of an injured, a family member, for sure. Yeah. Having a trauma or an assault or a battlefield experience, should be like the sooner the better. And I see it as, it's kind of like our a fault of our society that we have a technology right now that can save a lot of people. So we have, as a result of all of this over excessive stress on the nervous system, whether it's like taking a young doctor or a young lawyer or a young professional and just pushing them too hard, taking a Navy SEAL and then pushing them too hard through training, and then they're not what they used to be. So why are we beating people up? We do have the technology to kind of help recover from that, and which is the stellate block. What ends up happening when people have this trauma that they don't recover is I think they get it. There's addictions. There's ADD, there's addictions, there's family problems, there's sexual problems. And people are breaking the law. They're addicted to things. Their lives are falling apart from things that when we have the technology to actually, hey, you have this issue, let's fix it right. Let's address it right away. You don't have to go through that addiction. You don't have to go through that, that flailing of your life, flailing of your marriage, your relationships, mistreating your kids, traumatizing everybody that you touch, and also not being able to enjoy life yourself. So I think that as a society, we need to step up, and I'm not sure exactly how, because I think a lot of people have tried. Certainly, Sean Mulvaney has tried to step up and push and say, "Hey, this is what we need to do." Right. So this combined with other aspects and of what you do, then I think that's essential.
Yeah. No, I mean, I think that I think that if we're trying to heal from a complicated thing, from a complicated health issue, working on the trauma is essential. Unfortunately, a lot of doctors don't have time for that, or it's really reserved for psychologists or mental health therapists or psychiatrists. But when we're dealing with complicated issues, removing or helping with the trauma, and that's, could be with a medication, but oftentimes those have side effects.
Could be with a diagnosis, just knowing you have that disease, right?
Yeah, and patients will get anxious about just the
diagnosis. I mean, it's kind of normal, right?
But when you work on the trauma, both from like a perspective that the patient is overcoming their trauma and living their fullest life, but also when you remove the trauma, you're actually, from a biological and physiological perspective, healing the body, because now it's in a parasympathetic state, your immune system's better. And so not only are you feeling better that you worked on your trauma, but your actual biology is better. And so you're able to heal. And so I think it's kind of an amazing thing, because I mean, we were designed probably to, just hunt, eat, relax, reproduce, and, enjoy our lives. But now, with their fast paced, in 2024, there's all of these things that mimic animal threats to us on a level that's constant. And even our phones, our Instagram, a constant barrage of information that is getting our nervous systems in super heightened and dysregulated. And so, whether you do, we still believe in meditation, we still believe in working on yourself, we still believe in, some element of talk therapy, but sometimes we need that little extra assistance from somebody. And this little extra assistance can be kind of transformational for a lot of people and get you going on the right path.
Oh yeah. And we've seen that over and over again.
Yeah.
And even with your personal experience, I mean, we talked a lot about you becoming a doctor, and we'll talk more about that. But there's just this growth of you as a person that could be related to, hey, what are the issues that you had that impacted you as being a patient? It's like, hey, I feel better about this is what I want to do for my patient.
Well, what came to mind is I had a major back issue. I was doing a deadlift. I was too young and too rambunctious and did a deadlift I shouldn't have done, and herniated my L5S1 disc really bad. And I was dealing with kind of sciatica pain for a long time. And I tried all these things. I tried the McKenzie thing. I tried a lot of different techniques to try to get my sciatica better, but nothing ever worked really. And it just kind of got worse and worse. I got an MRI, it showed a huge herniation. And I ended up getting a microdiscectomy because I was about to enter residency, and it was in like really debilitating pain to the point where it was like an 8 out of 10, and I couldn't sleep without like 3 Advil. So it was really kind of significant. And so I kind of understand pain. Like I wouldn't have understood before. And I kind of thought about low backs, and I kind of got interested in like what causes sciatica and discs and nerves. And so that kind of became something I'm like, maybe someday I'll think about low backs and treat the spine, because, as a family medicine doctor, we usually don't treat the spine. We don't think about the spine, and even traditional sports medicine doctors don't really think about the spine that way. But I became kind of passionate about it and learned through my experience about how the back really works and what causes nerve pain. And so I ended up with a microdiscectomy, which got me out of pain, but as you know, sort of destabilized the area a lot. Now I have kind of scar tissue, and I had scar tissue and muscles that weren't firing, and fatty atrophy of muscles, which happens when those nerves, right, the innervation and the intelligence that is going to that area is compromised. And so I had all of those things. And so, when I heard Dr. Cook talking about, regenerative medicine to the spine, that's when I perked up and was super interested. And so to this day, I have a compassion for people who have had back issues. And, fortunately, I'm in this position where I'm able to get treated regularly, and I'm like the best I've ever been, and, back to a lot of things that I always wanted to get back to. So still a journey, and still kind of figuring things out, what works for me, how does this even play a role in the patients that I'm treating? And so I think that in our field and doing things first person is really kind of important. A lot of the things that we do are evidence-based, but there's some that aren't as evidence-based that kind of we all agree works. But I usually am someone who wants to try something on myself first before I do it. Whether it's a supplement, I'll take the supplement for 4 weeks before I recommend it. I'll do a carnivore diet for 4 weeks before I recommend it. All of these things. And so, for example, the stellate ganglion block is something that I really wanted to do on myself before I did it on patients, really to understand what it's like, what it's doing. And so, I had some anxiety probably from all of the stress that I had through my medical training and stuff like that. And so the stellate ganglion block actually really helped me. And I have the least anxiety I've ever had. And that might be due to a variety of factors, but I think the stellate did help me. And so I believe in it, not only because of myself, but also because of what I've seen in patients. So, yeah. That's
great. Now the other thing to get through is like, I think what everybody who's not a doctor wants to know is, the journey of what you've been through emotionally, what you've learned about people, how you learned to communicate with people, because what do you feel like has changed in your understanding of humanity and yourself in this process of, learning and trauma and helping and getting better? So that's that personal growth that I think, you get a unique exposure to. I mean, you had some experiences that a lot of people haven't had an opportunity to have. So,
well, I think working on yourself is what all doctors need to do to really usher patients to healing, because it's people make the joke, if your doctor's overweight or something like that, do you trust their diet advice? I mean, I think on some level, doctors know what the advice should be, but they don't always take it. When you take ownership and you do these transformational things for yourself, you're able to usher your patients better. You're able to be a little bit more confident in chatting with them. And I think patients appreciate honesty. I mean, that's really what I've noticed is when I just come in as a friend and I say, what's going on? Tell me your issues, and I say, have you thought about this? And, doing it in kind of a nice, elegant way, patients really respect that. And that's been my approach, is really just kind of like I'm talking to you, just talking to patients and being honest and forthright about things. And I always am saying, if I were you, I would think about doing this, but I'm not you. And I know this might be a good idea, but I know how expensive this is. So I don't necessarily, this is not a hard sell for me to do this. This is an option for you. So I try to be as super empathetic, and I imagine myself looking at myself in that seat, and I think that's what I try to do. And I think patients usually appreciate that.
I think so. I think that a lot of doctors recommend treatments they would want for themselves. I think that's just that's a good question. That's a question that I see you get asked, that I see me get asked on a regular basis. Hey doc, but what would you do?
If this were you, right?
Yeah. So I think that's a valuable input. And, what have you learned about people? What have you learned about understanding people's stress, their trauma, who they are, what they're about, going through this process?
On some level, I think everybody is traumatized, right? It's a little bit of degrees of trauma, but everybody has something. And part of my job, if I'm ushering you for a complicated situation, is figuring out what level of trauma that is. Seeing if you're able to kind of communicate with me, and I try to do it in a good way. I hope I do, and really discussing with them. And patients are pretty. I think most patients now, and it's kind of an old school kind of military way of like, don't spread your crap around. But I think most people now are kind of open to talking about it. And I'm certainly open to it. And I want to hear it because that is how you're going to heal. And it's kind of crazy. It's like, we're all kind of, you and I, all of us in this field are psychiatrists in some way. And so, being that listening ear for them and understanding where their trauma is going to help guide their treatment, whether they know it or not. That's a big part of it. And I always encourage patients to share that with me. And I think it's helpful. And I think patients are just kind of, They want honesty from their doctor. They want their doctor to be straight up. They want to know, is this going to work? What is this going to look at? What's my recovery like? They don't want you to dance around too much. They want your doctor to kind of give you some kind of concrete things. And so that's kind of, I'm someone who likes to talk. I'm like a philosophy guy. I like to get into it. But I also know that sometimes maybe what I used to do is kind of get too much into the medical stuff and not even realizing that, hey, this is not a person who's been in the medical field. They don't know all of the things that I'm saying. So I try to think about it as basic as possible. And if somebody who, like a 10-year-old I want them to understand a majority of what I'm saying. And then if they're more interested or they have, then we get more into it, more complicated, more nuanced. But I think if it's the simplest explanation is usually the best explanation.
Oh yeah. And I see you go through this because what I see is, and what we all do, I think is when we're communicating with somebody. So communication is so important that everybody is not going to hear the same style of communication. You say something one way that didn't work. You say it another way that didn't work. You kind of go through this process of how do I communicate this story clearly to this person in front of me so that they actually get it and I'm benefiting them. Because if we know it, it's good. But whenever we can communicate it to somebody else, I think that's the real benefit. And that's what people are looking for. And I see you taking your time. You know what you're doing, but you're humble enough to question, is this person really getting it? And beyond that, there's this story of, there's some doctors, they either know the patient is wrong, because I can't be wrong. And some people are like, patient's probably right. How can I learn more? And I think you fit into that category, but in a way that kind of burns you, because when you're not working, what are you thinking about, right? You're hopefully you're focused on the people you're around, but it's also hard because you're.
Oh yeah, no, I won't rest until I feel like I've given the patient the best possible treatment plan. And I'll sit on a Saturday if I'm watching football or something with my girlfriend. I'm thinking about, what could I change here? Should we try to get them in? Should we do this procedure? Should I change this supplement? Do we need to do this test? And I'm always kind of thinking about it. So it's actually something that I need to kind of take a break from in a little bit and just kind of, but I think I'm okay with it because I want the patients to get better. And I think that not that they expect that, but that's what's required of this job, I think, because there's a lot of feedback from patients, and what works for one person is not working for another person. And so sometimes you got to kind of change things. And I think most doctors are like, no, finish the protocol, right? But if a patient's telling me, hey, I have a headache after I started this thing, I usually am like, I listen to the patient. I don't get defensive. I say, let's change. Let's do something different. Let's go in a different direction because this is not working for you. And that's like the art and amazingness of what we do,
As a patient, I love to hear that. As as an associate, I'm like, okay, well, that's really good, but you got to have time. You got to take care of you.
Right.
I think you do.
That we have access to things to help us recover, right?
Right, exactly.
That's kind of nice too. And then, so that's helpful. I believe in that, even things like sauna and, peptides and things like that, these are things that give us resiliency to help our patients too.
Well, that's great. Well, this, I think has been really informative. What I want to know is, how do people get a hold of you? So they want to see you, they want to find out more about you. How do they get a hold of you?
I work at BioReset. And so you can kind of Google BioReset, go to our website and see my bio, and you can call us to make an appointment. So we have an office in Campbell in San Jose area. And we now have an office in Santa Monica on Wilshire. And so I work out of the Santa Monica office. And, to schedule an appointment, just kind of call our office number and get an appointment. And, I'd love to chat with them and get into it. And usually we do a telemedicine visit first, kind of get in, explain what we do, how we do it, what we would do for you. And if it's a right fit, and then we kind of, figure out a treatment plan. So.
Excellent. Well, it's been an honor having you here, Adam, Dr. Adam Lustig.
Thank you so much for having me, Dr. Tierney.
All right. Thank you.